Live na po sa atin. 5 minutes po. Pagpapit ako.
So, pag 5 minutes before open na ito
Oh. Pero ay, hindi pa. Kala ko napapasok na to. Ay, na-desk pa tulo.
shall lead the light and lead a path to wisdom. Our will to be our lives to those in vain and suffering. We shall hear a call with arms to care and comfort from Master above all, to face a brighter future, bound in unity. The Philippine College of Physicians, we shall be hand in hand, building a stronger nation. This
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Everyone. I would like to welcome you to this afternoon's webinar entitled Hepatitis B. I am Dr. Ginger Rita alias Samonte, the head of the media communications of the Philippine College of Physicians, and I'm going to be this afternoon's moderator. So to start off with the program, I would like to welcome two people who are very special from the different society who is responsible for this afternoon's webinar. There are two people, very special afternoon webinar. Our first person to give the opening remarks will now be given an opening remark rather than a lecture. We have no other than the Vice President of the Philippine College of Physicians, Dr. Ron Jean Solante, and also another person from the Hepatology Society of the Philippines. We have Dr. Espinosa. Dr. Solante.
Yes, thank you, Ginger. No, Ginger is the head of our media committee. No? And first of all, I welcome all the media partners of the Philippine College of Physicians and all the lay people, no, mga followers ng PCP through the Facebook network or platform. But more importantly, our topic today, since we have been had a lot of topics of different infectious diseases like COVID-19, monkeypox, and we have also dengue that is really a problem now in the Philippines. Pero huwag nating pong kalimutan na meron pa rin mga infection na nanatiling mataas pa rin at mataas ang burden of illness at mga komplikasyon nito, no, na kailangan nating tugunan din in terms of raising its awareness kung ano itong klaseng infection na to, especially for those who are vulnerable. No? At ito yung hepatitis B. So at this point in this afternoon, we would like to thank first our two speakers, our renowned speakers, Dr. Payawal and Dr. Agkawili, for gracing this particular media forum. And I hope itong mga nakikinig sa atin at nanonood sa atin, maraming mapupulot na bagong information at magandang kaalaman tungo sa prevention and management of hepatitis B. Thank you, Ginger.
Thank you, Dr. Solante. And may I call on now the Vice President of the Hepatology Society of the Philippines for his opening remarks, Dr. Espinosa.
The officers and board of the Philippine College of Physicians, headed by Dr. Diana Payawal, to our esteemed speakers, and to all our participants, magandang hapon po sa kanilang lahat. In behalf of the Philippine Society of Gastroenterology and Hepatology Society of the Philippines, I welcome and thank everyone for joining us today. Today, we are celebrating the World Hepatitis Day. It is estimated that 354 million people globally are infected with viral hepatitis, and one person dies from it every 30 seconds. That's 1 million deaths per year, a greater toll than HIV and malaria combined. Ang Pilipinas po ay isa sa mga bansa sa buong mundo na may pinakamataas na bilang ng hepatitis B o tinatawag natin na hyper-endemic area. Isa sa bawat 7 kababayan natin ay may hepatitis B. Sa mga kababayan natin na may sakit na ito, hanggang 30% po ay pwedeng magkaroon ng liver failure o magiging sanhi ng kanilang pagkasawi. To achieve hepatitis elimination by 2030, we need to reduce new infections from hepatitis B and C by 40% and reduce death from liver cancer by 50% in 2025. For this to happen, we need to address service accessibility, affordability of medicines and tests, and lessen stigma and discrimination. This will be discussed by our expert speakers in the following lectures. I thank the Philippine College of Physicians for giving us this opportunity, and to everyone for participating in this webinar. I wish you all a productive afternoon. Thank you.
Dr. Wendell Espinosa, very well said. So patikim pa lang yan about what we're going to talk about this afternoon. So to just give you an idea, no? Ang hepatitis nga po sa ating mga media partners and our lay persons who are attending this webinar is that ito po yung pamamaga or swelling of the liver na commonly caused by the hepatitis virus, or it can also be caused by alcohol intake, pag-inom ng mga gamot na nakakasira ng ating liver, no? Ang tawag pa rin doon hepatitis. Pero po ang dahilan ay isang virus, ang tawag po doon ay viral hepatitis. At according nga sa ating dalawang nagbigay ng opening remarks, si Dr. Solante and si Dr. Wendell Espinosa, sinabi nga po na malaki din problema to sa ating bansa at isa siya sa dahilan ng pagkakaroon ng malaking problema sa sakit sa atay. So, without further ado, I would like to continue with our webinar series by introducing our renowned speaker for this topic. We have 2 speakers who will be talking about this hepatitis, Usapang Hepatitis. Our first speaker is Professor Dr. Diana A. Payawal. She is currently the president of the Philippine College of Physicians, and she is a professor too at the Fatima University Medical Center. She is the chair of the Department of Internal Medicine in Fatima University Medical Center in Valenzuela, and the chair of the Hepatology Committee Section of Gastroenterology in Cardinal Santos Medical Center. She had her Harvard Medical School Leadership Scholarship Program, and she's also the past president of the Asian Pacific Study of the Liver and Philippine Society of Gastroenterology and Hepatology Society of the Philippines. So, we'll welcome our first speaker, Dr. Diana A. Payawal.
Good afternoon to everyone. I was given a task to give a talk on the burden of the disease in the Philippines, how common it is, and what are the global and regional incidence and prevalence of this disease itself. So how common is it? This is the figure that about 257 million people are living with chronic hepatitis B. And if you look at it closely, more than 887,000 people die every year due to the complications related to it. And that is, of course, liver cirrhosis and liver cancer. So what is prevalent here, and you can see it, that hepatitis B is the highest in the Western Pacific region. And of course, about 11 115 million people actually have the disease itself. Now, what is hepatitis B? Hepatitis B is a virus that is transmitted through contact with blood or other bloody fluids of a person living with hepatitis B. And it can also be transmitted from mother to child or even from person to person in early childhood because the virus lives outside the human body for almost 7 days. But the good thing about it is it can be prevented by a safe and effective vaccine. And you can see on the right side of your screen that the third dose of hepatitis B coverage in infants with a very high global coverage of about 84% in 2018. Looking at it closely, the Western Pacific region has the highest burden of liver cancer globally, accounting for 60% that live in our area. And 60% of new cases of liver cancer was seen in 2018, and this 60% of liver cancer deaths worldwide was also seen. Now you can see here that we see 841,000 new cases, and look at the death, almost 781, not far from the new cases that we see. So just to show you that this is a dreadful disease, and it can be prevented actually by vaccination. Now let us see the figure that we have concomitantly with it. In cirrhosis, you can see this is the Philippines and the other Western Pacific area or the Asian countries. The Philippines actually have a lot of liver diseases. And you can see here, you have alcohol, hepatitis C, and hepatitis B. And you can see that the more common scenario is, of course, the hepatitis B and alcohol. So just to reiterate that we were actually part of the syntax bill on controlling the use of alcohol. Just to show you that both alcohol and hepatitis B can lead to liver cirrhosis. Now, when you look at liver cancer itself, you can see that liver cancer is actually almost the same. For hepatitis B, it is actually over 40%, and for alcohol, it's actually not as much. So liver cancer in the Philippines is actually due to hepatitis B. Now, because of this growing concern of a lot of patients dying of liver cancer due to hepatitis B, the WHO has come up with a developmental goal, sustainable SDG, which is the elimination of viral hepatitis as a major public health threat by 2030. But of course, this was before the pandemic. Now, there are 5 core interventions that were identified, and this is the 3 doses, the birth dose, the blood and injection safety strategies, the harm reduction, and of course, the test and treat strategy. So you can see that the first 2 are labeled on vaccination coverage. So by 2020, which was last 2 years ago, we should have covered about 90% of our hepatitis B vaccination among the newborn. And that is why we have the so-called expanded immunization program of hepatitis B vaccination within 24 hours. The birth dose of hepatitis B vaccine, which is 50%. And of course, blood and injection safety profile, which is in most of the hospital, 100%. And of course, harm reduction was set at 2,200 with a testing of almost 30%, and that is 5 million and 3 million treated for hepatitis B and hepatitis C. With this strategy, we can see now a decrease and decline of viral hepatitis as a major threat, achieving it by 2030. But of course, things really have changed, and that is why we are readjusting this because of the pandemic. Now, when you look at it closely, beyond vaccination for hepatitis B is the prevention, and that is to get towards the elimination of hepatitis B by 2030. It is important to have a national comprehensive strategic plan or action plans, which includes both prevention and treatment. And these national plans articulate the vision, goals, and the set strategies to be achieved and funded for the country. In the Western Pacific region, it consists of about 37 countries and territories, and more countries now are developing their national plans for the prevention and treatment of chronic hepatitis, whether it's B or C. So you can see here that 50 countries more need to be addressed. This is already 15 countries which are available. It is not yet seen in about 15 countries, quite half, but there are still initiating discussions about this, but there are already developmental strategies that have been advocated. As I mentioned, this was before the pandemic. It's January 2020. In our country, the pandemic and the WHO started to say the COVID pandemic in March of 2020. So we need to see whether this comprehensive national response to hepatitis prevention and treatment actually is in their right timeline. So what about successful vaccination? Universal childhood vaccination is the mainstay in the prevention of chronic hepatitis B. And the Western Pacific region has set increasingly higher targets because we are predominantly in the area where hepatitis B is higher, and therefore there is a higher, tighter target towards the reduction of new infections among children. Now, shown here is the verification status of the countries and areas in the meeting in 2017, which is less than 1% target. 21 countries highlighted in blue. And you can see here that the Philippines is actually in the zero survey completed, and we have actually our results pending. So 21 countries highlighted in blue have been verified as having met the standard of 2017 target. Now colored green, which is actually Japan and Samoa, conducted zero surveys showing less than 1% prevalence in the date. And the red and the pink are the colors of 6 countries that require the program improvements. So the Marshall Islands is currently under verification review. And at this point, the Philippines recently completed, as I mentioned, the status, and it is awaiting the zero survey. So, and of course, the other countries are indeed preparing, and this is the Fiji and the Nauru, which has to do with their zero surveillance. So just to show you that the regional hepatitis B prevalence among children 5 years of age is about 0.93%. So you can see that most of the countries are within the target of less than 1% hepatitis B surface antigen among the children. I hope we can come up with our data, and we can be like any other data, which is actually in the blue, verified that we actually have the less than 1% target. Now, the drawback about this is that there is a large gap of care in the prevention of hepatitis B. You can see here that for hepatitis B in the left side of your screen, that 17% of people living with hepatitis B are diagnosed, but only 20% of the diagnosed patients receive treatment. So this is a scare that although we identify them, the treatment or the access to treatment is not available. So in hepatitis C, it's the same. 20% of people living with hepatitis C are diagnosed, but only 9% of those diagnosed actually receive treatment. So the hepatitis B cascade, not all people infected with hepatitis B need treatment. So that probably is one of the drawbacks, and they need to have the staging. So much has to be done in the scaling and service delivery of hepatitis B in identifying patients who needs treatment and who can actually profit from the treatment strategy that is available. When you look at the access to hepatitis care, this is affordability, sustainability of financing, you can see the different countries here, and the access to medicine for hepatitis B, we do have improvements. In general, most countries have drugs for hepatitis B, and that has been registered in our FDA. And most countries do have the registration of the DAAs for hepatitis C, and this is completed or in progress. However, registration of drugs does not mean access to most of the patients. And you can see here that in several countries, hepatitis C are now under the universal health coverage, taken here as being financed by the health insurance and thus accessible to most of the population. Now, the high cost of hepatitis C DAAs remain challenging in the region, even among countries which have the drug registered and are covered. And affordability of tests and treatment remains an issue in many countries. Thus, more work has to be needed, and we need to see strategies that will make our hepatitis B financed by the available government agencies or national health insurance. Now, the Philippines is one of those few countries, along with Cambodia, Papua New Guinea, wherein hepatitis B is not fully covered by the national health insurance or government funding. And this is something that we need to really work, and I challenge the Philippine College, the Hepatology Society of the Philippines and the Philippine College of Physicians in partnership to make it affordable and access to health care. Although there are steps already in putting it into being financed by the national health insurance, and I think this is now available in some centers, specific only centers in areas. This was shelved actually only because of the COVID. So I guess we will see more changes right now, and I know I will show you the new strategy that has been advocated in some of the areas in the Philippines. Now, liver disease death as a proportion, you can see here on the left side of your screen that we actually have less than 3%. So why focus on Asia for liver disease? You can see here our partners in the Europe and USA. We have a 4.6% death that is actually seen in patients with in the total population of Asia, as compared to 2.1% and 2.7% in Europe and USA, respectively. So if you can look at it in that perspective, it is Asia that is the leading in research and probably in strategies as far as control of liver diseases related to viral hepatitis. So on the figure on the lower bottom, you can see 62% of all liver-related deaths globally. 54% of all cirrhosis is in the Western Pacific area, is in Asia, and 72% of all HCC deaths is actually found in our region. So that is why we need to really look at it prospectively. Now, when you look at hepatitis B, there is a changing seroprevalence. You can see now because of vaccination, this is actually decreasing through time. And that is why this seems to be something that is a light at the end of the tunnel. So we can like push the vaccination. I know there are a lot of vaccines that are being advocated with COVID. We do the vaccine every 6 months, and there is a flu vaccine, pneumonia vaccine. But don't forget, hepatitis B is a growing concern also in the Asia Pacific region, and we need to really pep up our strategies in doing moves to actually control this disease, and vaccine seems to be an easy way out. So the number of deaths now, this is a cause now for the local setting. Now, this is the number of registered deaths ranked as the 50 leading causes of deaths in the Philippines. And this was released in 2020 and 2021, just recently. And you can see that liver cancer or the diseases of the liver is actually the 13th cause of death in the Philippines. But what is glaring is when you look at neoplasm, it's actually the third. So when you look at the figure of the most common cancers in the Philippines, you can see that in 2016, down the ranks of 2021, liver is actually in the top 5. You have liver initially in the 2016, and I'm very happy because we have shown that when you identify these patients early, when you actually give the benefit of treatment and putting patients with cirrhosis in a surveillance or screening strategies for liver cancer, you can see that it has gone down to the 4th most living cancer in 2021. whether this is a good thing because colon, which is part of gastroenterology, is now moving up. And I am very much surprised to see it in the second most common cause of neoplasm, new registered deaths in the Philippines. And this is by the Philippine Statistics Authority. So this is a growing concern that you need to do. There are ways of identifying patients early. There is a colonoscopy for colon cancer. For liver cancer, there is close monitoring of your patients with hepatitis B, NAFL, metabolic associated fatty liver disease, and of course for those patients with cirrhosis. This needs to be followed up closely because you can do so many new things for patients with cancer. So let us see now the burden of the liver disease. There are two burdens, prevalence both by the National Nutrition and Health Survey. There is 16.7% that was initially in the adult population. And there is a new strategy that was released by the Center for Disease Analysis Foundation. And this is a study in 2017 showing that the prevalence projects a decreasing trend in chronic hepatitis B and C. However, liver-related mortality and morbidity from these diseases are still expected to be maintained. So you can see that it has decreased to 7.3% million Filipinos in the recent data. Now, for hepatitis C, it suggests about 700,000 to 1 million Filipinos are actually infected. Case fatality is 0.82% to 1.29%, lower than hepatitis C, as I mentioned. Most of our patients actually needs to be followed up closely. For men, MSM, or men having sex with men, it is about 7%. And for hepatitis C, it's 51%. So it's not probably a wise strategy to say that this is actually a sexually transmitted disease. You can, as I mentioned, you can have it in mother-to-child transmission, and therefore you need to identify these patients early on. Now, the prevalence based on 2017 data is about 99.7, equivalent to about 10 million. So this is something that is a good way because we've seen it go down in 2017. And you can see here that the 0.58% equivalent to 614,000 infected with a genotype of 1. So I do admire the move of our new government and of course the previous government, President Duterte, in addressing patients with drugs, because hepatitis C in the Philippines is most prevalent in patients who actually do drugs. So this is the halt and reverse hepatitis B and C by 2030, and this is the DOH implementation framework. So what they did in 2017 to 2018, they prepared, and in 2019, they demonstrate the program. So there is an execution supposed to be a rollout in 2020 to 2022, but this all shelved because of the COVID. And this then should have achieved a sustainability by next year with a national health insurance coverage. So there is now a PEP-UP system, a system that increases fold so that this can actually be on the timelines that was given, and that is the 2030 eradication in most of the country. So in 2017, as I mentioned, there was a lot of administrative order, a policy in controlling viral hepatitis using of the National HIV, AIDS, and STI Prevention and Control Program. And these are the various Republic Act on mandatory immunization, as I mentioned, within 24 hours. The Republic Act 1052-6, which is an act of the month of January as the liver cancer month and viral hepatitis awareness in the month and prevention, and for October purposes, and the DOLE, which is the guidelines for the implementation of workplace policy on hepatitis B. Now, on the right side of your screen, you can see the vaccination program. We were achieving what is it, but beyond that, we need to see what is evident in 2022. So this still has to be growing. We are actually achieving now the hepatitis Hep 3 vaccination program in 2020. And the timing is about in 2009, it was 34% in less than 24 hours. It drops from 14 hours. More than 24 hours is 24%. Now, why is this so? We were actually affected by the Dengvaxia scare. So a lot of the mothers did not like the children to be vaccinated within 24 hours. So this was this political scenario really affected all the vaccines, and hepatitis B is not is one of them that was affected by it. So we were really achieving it until in 2020, but I think, as I mentioned, because of the Dengvaxia scare, this move to have vaccination as an expanded program for immunization, as basic immunization service for infants as mandatory, was not achieved in the community level. So you can, what is the number? Now, when you look at it in perspective, the number of deaths for hepatitis B is also glaring. And you can see here that in 2017, it was 431, very high in 2019, but it's actually going down. Now, this is a figure only from January to June. So we probably will see this to be increasing in the next few months. I hope not, because we were already achieving our targets closely. So the drop for the new number of deaths from viral hepatitis is something that we look forward, because we need, and we have done a lot of things for this. First is there is information dissemination strategies. This was started by the Hepatology Society of the Philippines in partnership with the DOH. And this July 28, which is a World Hepatitis Day, is always part of all hospitals' engagement for connecting or for controlling the disease itself. So, but I think the key factor is cascading services, and this was modeled in Central Luzon. This is the integration of chronic hepatitis B management in selected health facilities in the NCR and Region 3. Now, you can see here that this is a demonstration project, document to susceptible of viral hepatitis B service delivery and referral model, including packages of services, recording and reporting system with monitoring of cascade of services. Now, what it did was establish a baseline information of cascade of cure, which is screening, treatment eligibility, treatment coverage, and then evaluate the service delivery and referral model for planning of sustainability and implementation expansion. So you can see the 27 sites that were identified, and there was an end referral system that was done. And you can see that the number of cases was a good one, but it was stopped because of the COVID. We were locked down, the services were shelved. And at this point, we were seeing a lot of cases that were registered. The master list was increasing. And you can see that most of those patients who need treatment was actually benefiting from treatment. But this was the model that was done, in all fairness, by the DOH and in 2019 to 2020. But because of the pandemic, this was actually shelved, and now they're reinstituting these services in a bigger scale. So for hepatitis C, the memorandum has been there. There is already guidelines in the management of patients diagnosed with hepatitis C. And you can see here that most of these cases, this is the breakdown of treatment. Not much patients actually needed treatment because there's not much cases in the community. And but there is already a Department of Health memorandum to address this. So there is what are the most critical barriers for hepatitis B? There is no outpatient package for chronic hepatitis B patients as of present. Most of the programs are aligned with the devolution transition program, and COVID-19 restrictions are actually a problem. Now, the stigma and discrimination still is a big concern because right now hepatitis B is being linked with the HIV clinic, and I feel that that is actually creating also a lot of dilemma for patients to come and get the drugs. For hepatitis C, this is, as I mentioned, the retention of clients, most especially who are far from the community. So we need to be the one to deliver the drugs to them. There are shorter, near expiring delivery of supply of hepatitis C, especially during the time of the COVID, and communication with needy patients who have no cellular phones. I always feel that, it's really difficult to control these viruses because we are an archipelago. It's not like Singapore, they're only one island, or the others. We are actually in an archipelago, which is body of water separating us. And sometimes it's really difficult to send drugs to our patients. So this needs to be addressed. And for a fact, they have no cellular phones. They cannot call us. Wi-Fi system is a drawback. So, and of course, the permanent residents. So these are some of the critical barriers that hampers the care of patients with hepatitis B. So for our strategy, the Philippines need to have a fourfold strategy: promote greater public and political awareness. I think you as a media should help us, partner with us on this aspect of promoting greater public awareness. We need to strengthen the government's role in implementing the comprehensive program to prevent and control viral hepatitis B. We need to strengthen civil society. And of course, lastly, to empower peer-based aspects on the system, develop a tailor-fit activity. So these are the different strategies that we need to work on so that we actually can help the government in pursuing a control of viral eradication by 2030. Lastly, as I mentioned, the Philippine College of Physicians partners with the Hepatology Society of the Philippines to be aware and be protected. I think vaccine, just like COVID, is the key factor to prevent this virus, and therefore we need to disseminate this information to a lot of our healthcare workers, a lot of our community members. So again, thank you to everyone, and I hope you enjoy the conference.
For your comprehensive lecture on the burden of hepatitis B as well as hepatitis C in the Philippines. So before we proceed to our next speaker, may I remind our attendees that you could could type in your questions in our chat box, or in our those who are in FB Live can also type in your questions so that our speaker may be able to answer your questions or clarification regarding this afternoon's webinar topic. So to continue with our afternoon's webinar, we have another speaker. To talk on fast facts on hepatitis B, we have Dr. Jeneline Agkawili Conde, who graduated from the Doctor of Medicine from the UST University of Santo Tomas. She also took her residency training program in internal medicine in San Juan de Dios Hospital in Pasay City, had her fellowship in gastroenterology and hepatology in Cardinal Santos Medical Center, her fellowship in hepatology and transplant hepatology in the National University Hospital in Singapore, and an associate professor at the Department of Medicine, College of Medicine, De La Salle University Health Science Institute in Cavite. And currently, she is the treasurer of the Hepatology Society of the Philippines. Let us welcome Dr. Agkawile Conde.
Okay, good afternoon. Okay. So good afternoon po sa inyong lahat. At ngayong hapon, marami pong salamat muna sa Philippine College of Physicians sa pag-imbita po sa amin sa pagpapalaganap ng awareness regarding sa hepatitis B. Ngayong hapon, ako ay magdi-discuss about hepatitis B. So these are the fast facts on hepatitis B. So sa hapong ito, At the end of my lecture, participants should know who should be tested for hepatitis B, on how testing for hepatitis B is done. You should know also how, if a person is positive with hepatitis B, and be aware of the existing rights of employees. So as mentioned by Professor Payawal, hepatitis B infected a lot or around 257 million people worldwide, and around 9.7% or 10 million Filipinos uh, dito sa ating bansa. So imagine around 1 out of 7 Filipinos have viral hepatitis B infection. So karamihan ng mga Pilipino, hindi nila alam na infected pala sila with hepatitis B. So we emphasize or we have the celebration of World Hepatitis Day kasi nga deaths due to viral hepatitis B is increasing. So compared to tuberculosis, HIV, and malaria, as you can see in this slide, hepatitis B has increasing number of deaths. So in this slide as well, as you can see, having hepatitis B and its complications such as liver cancer or hepatocellular carcinoma and cirrhosis cause the increasing deaths because of viral hepatitis B and viral hepatitis C. So having chronic hepatitis B infection is the most common cause of liver cancer. So, and second is another viral hepatitis, the hepatitis C, alcohol, and sumusunod na ngayon yung non-alcoholic fatty liver disease or the metabolic associated fatty liver disease. So ang laging tanong ng mga pasyente, paano ho ba nakukuha ang hepatitis B? So ang hepatitis B po ay isang klase ng virus na nakukuha or natatransmit through blood-to-blood contact or any exchange of body fluids. So if there is unprotected heterosexual sex, or unprotected homosexual sex, kung kunwari yung isang partner is infected with hepatitis B, sharing of needles, or any receipt of blood products before 1987. Why? Because before 1987, hindi kasama sa pag-test ng blood bago i-transfuse yung hepatitis B. However, ngayon po, dahil sa batas natin, lahat bago makakuha ng blood transfusion, ipapatest for hepatitis B or any needle stick injury. So kahit basta natusok ng karayom na hindi malinis, for example, yung mga pasyente na nagtatattoo, hindi natin sigurado na yung ginamit needle pala sa inyo hindi malinis or nagamit sa ibang tao, o di kaya make sure yung mga nagpapa-ear piercing din, na make sure yung needle na ginamit sa inyo ay bago at malinis. And 70% of Filipinos na may hepatitis B is still from mother to child or positive si nanay na ipasa sa anak. So pasa ho siya at hindi mana. So it is what we call vertical transmission. So these are the modes. Ito yung summary on how patients can get hepatitis B. So pwedeng via yun nga, injection, or IV drug user, through sex, or unprotected sex. Another high-risk population is yung mga hemodialysis patients because they have been always have needle inserted para makapag-dialysis sila. And another high-risk patients or mga high-risk population, yung mga healthcare worker or mga public safety workers. Why? Because they are exposed with needles. So others are also mga organ transplant recipients, patients na may hepatitis B na kasama sa bahay or household contacts, blood transfusion recipients, or any needle stick or sharp instrument injuries. So, wag kong matakot kung may hepatitis B kayong kasama sa bahay. So, for recommendations for patients infected with hepatitis B, so we advise as part of counseling ng mga pasyenteng may hepatitis B na dapat lahat ng mga kasama sa bahay, pati nanay at tatay at mga kapatid, is magpa-check up din kung meron silang hepatitis B. So magpa-blood test din. Of course, we also advise to use barrier protection during sexual intercourse, lalo na kung yung partner ay hindi vaccinated against hepatitis B. We also advise patients na for infected patients with hepatitis B na huwag manghihiram ng toothbrush or razors. Kasi syempre, pag nagtutoothbrush, hindi naman sinasadya, minsan nagdudugo, no? Yung mga gums. And pwede mag-stick yung virus doon sa toothbrush. At tapos, pag ginamit ng partner, nag-toothbrush din, pwedeng nasugat, pwedeng matransmit doon yung Hepa B. O kaya yung mga nag-aahit, no? Minsan, yung nang ihihiram na mga pang-ahit, hindi nila alam na yung pinanghiraman pala nila ng pang-ahit ay may hepatitis B, tapos nasugat din sila. So pwede rin silang ma-infect or matransmit sa kanila ang virus ng hepatitis B. Of course, if there are any blood spills, to clean right away with detergent or bleach. And of course, we advise patients with hepatitis B not to donate blood anymore or organs or sperms. So for children and adults who are hepatitis B positive, so we also advise hindi sila dapat pandirihan. Hindi dapat ihiwalay mga kutsara, baso, mga tinidor. Pwede silang yakapin, no? So for children with hepatitis B, they can, and of course for adults, no, they can always participate in all activities, including contact sports, even basketball or mga wrestling pa yan, no? They should not be excluded from daycare or school participation and should not be isolated from other children. And as I mentioned, they can share food, utensils, or even kiss other people. Hindi basta-basta nahahawa ang hepatitis B. Katulad ng binanggit po ni Professor Payawal, ang World Health Organization has this strategy of global action on viral hepatitis, in which the goal is to eliminate viral hepatitis as a major public health threat by 2030. So the target is at least 90% to prevent transmission of hepatitis B and at least 65% reduction of deaths with regards to hepatitis B. So bakit nga ba binibigyang halaga ang hepatitis B? Ang hepatitis B, because it can lead to a chronic disease or it can lead to a lifelong disease, no? So unfortunately, sa totoo lang po, wala pa hong gamot or tableta na kayang tanggalin yung virus sa atay. Ang mga available po na mga antiviral na tableta for hepatitis B is yung kayang patahimikin or patulugin lang po yung virus sa atay. Ayaw natin silang gising or reactivated or activated dahil pag once nagising ang virus sa atay natin, pwede siyang mag-cause ng pamamaga at pag namaga ng namaga, pwede ho itong eventually mag-lead sa pagkasira or what we call cirrhosis. At pag ang cirrhosis, ito yung kung saan ang estado ng atay, kung saan ay sira na or what we call end-stage liver disease. And having cirrhosis can lead to a lot of complications such as, yun nga, pwedeng magkaroon ng liver failure, pumapalya na ang atay, yung ibang pasyente magde-develop ng complications such as esophageal varices, ascites, kung saan nagkakaroon ng pamamanas ng tiyan, or worst case scenario, pwedeng mag-develop sila into liver cancer. So that's why we advise all patients na as simple as blood test na may mataas na SGPT or ALT, no? Ito ang nagsasabi na may pamamaga na ng atay natin. Na unang-una, magpa-test po for hepatitis B. Kasi karamihan pa rin ng mga Pilipino, hindi nila alam na may hepatitis B sila. There are also other causes kung bakit namamaga yung atay. So, pwedeng other viruses such as hepatitis A or hepatitis C. Of course, alam naman natin na ang alak, pwede siyang mag-cause ng pamamaga ng atay at pagkasira. Ngayon, dumadami na yung mga tinatawag nating metabolic associated fatty liver disease. Other possibilities, yung mga tinatawag nating mga autoimmune hepatitis. Ngayon, pag namaga ang atay, there are also other tests that we can do para malaman natin kung nagsisimula na bang magkaroon ng peklat or pagkasira ng atay. Ito yung mga tinatawag nating mga non-invasive tests such as liver elastography or liver fast, which is available na sa ating bansa bago pa mauwi sa pagkasira or yung tinatawag nating cirrhosis or even liver cancer. So unang-una, we advise to be tested para malaman natin kung infected ba tayo with hepatitis B. So, of course, sino ba yung mga testing targets natin? As we know, as they mentioned, hepatitis B is very endemic or very prevalent dito sa ating bansa. So that's why all Filipinos should have an access and be offered with testing for hepatitis B. Of course, the high-risk populations, those who men who have sex with men, people who inject drugs, incarcerated or in chronic care facilities, commercial sex workers, people living with HIV, our OFWs, of course, those who have clinical suspicion of chronic hepatitis B. So yung kung may makita kayong pasyenteng parang naninilaw na or parang nagkakaroon ng ascites or lumalaki yung tiyan, of course, we advise all pregnant women should be tested with hepatitis B for early detection. Blood donors, it's already part of all before blood transfusion na itetest for hepatitis B. Sexual partners, family members, and those who close household contacts of patients with hepatitis B infection, and as healthcare workers. So, how do we perform screening? Ano yung mga nire-request ng inyong doktor para malaman natin kung may hepatitis B tayo? So, at least kahit itong tatlo lang ang i-request para malaman natin kung infected ba tayo with hepatitis B. So, the test that we could request is what we call the hepatitis B surface antigen or the HBsAg. Dito natin, kung ito ay reactive, dito natin malalaman na may hepatitis B tayo. The anti-hepatitis B core request, so if we will know if we have a past or current hepatitis B, and the antibody for hepatitis B surface antigen. So, the anti-HBs. So, this is to know kung ito naman ang positive, e malaman natin kung meron na tayong immunity against hepatitis B or protected tayo against hepatitis B. So, as I mentioned, ang pinaka-importante sa mga binanggit ko is para malaman kung we have HBs antigen positivity. So, this will tell us if we have hepatitis B infection. Of course, another awareness that we would like to share to people is second is to be vaccinated. So for those patients na hindi naman infected with hepatitis B, ibig sabihin HBsAg non-reactive at ang anti-HBs nila non-reactive, maganda pong magpabakuna. Alam naman natin na kung anong proteksyon ang may dudulot sa atin ng bakuna. So, usually, ang bakuna for hepatitis B is given for 3 doses. So, during for this day, after 1 month, and after 6 months. And lastly, for patients with hepatitis B, we advocate to be treated. So, ano ba what are the goals of treatment for patients with hepatitis B? Of course, number 1 is to improve survival and quality of life. So, the antiviral treatment or the available treatment for hepatitis B, it helps to decrease the hepatitis B virus replication. And of course, to prevent complications of chronic hepatitis B, such as hopefully to prevent liver failure, liver cirrhosis, or even liver cancer. Other additional goals in the treatment of hepatitis B, of course, to decrease the mother-to-child transmission, to prevent hepatitis B reactivation, or yung magigising yung virus, to prevent or treat extrahepatic manifestations of hepatitis B, And for patients with acute hepatitis B, to prevent liver failure, or it also helps to shorten disease duration. So we advise pag ang pasyente na may hepatitis B at nag-develop na sila ng cirrhosis or pagkasira ng atay, lahat po sila ay dapat mabigyan ng gamot para sa hepatitis B. Ang ating gobyerno, sa tulong ng DOH po, they offer free antiviral treatment for patients with hepatitis B na nangangailangan. So hindi lahat ng pasyente na may hepatitis B ay kailangan kaagad magtableta. So we advocate for those patients na nag-develop na ng liver cancer or nagkaroon na ng liver complications, liver and liver cirrhosis, or meron ng significant fibrosis sa kanilang atay para ma-prevent ang lalo pang pagkasira. So in this slide, sa tulong ng ating gobyerno, they offer free antiviral treatment. So ito yung mga facilities na nagbibigay ng libreng tableta or gamot for hepatitis B para sa mga nangangailangan. Another rising problem sa mga pasyenteng may hepatitis B is yung naghihingi ng clearance for pre-employment. So we advocate to have an anti-discrimination law, para hindi porke may hepatitis B sila ay dapat hindi na sila kagad tanggapin sa trabaho, So kung hindi naman sila healthcare workers, kunwari yung mga kaibigan natin, mga janitor, security guard, sa tingin namin ay dapat sila mabigyan ng ng pantay na karapatan na pwede silang tanggapin kahit may hepatitis B sila. So I would like you, meron akong isang pasyente, nanghihingi sila ng clearance sa akin dahil may hepatitis B siya. Tapos sinabi sa kanyang trabaho na hindi siya tinanggap. Bakit? Dahil daw may hepatitis B. Pwede daw makahawa. So that's why we have this advocacy na ipaalam sa lahat na hindi dapat i-discriminate ang mga pasyenteng may hepatitis B. At sa tulong ng DOLE Advisory, we have a note to employers na a positive hepatitis B or a patient with hepatitis B should not be a basis to discriminate or restrict or disqualify a job applicant from being gainfully employed. So a hepatitis B positive applicant should not be declared unfit to work and denied employment without appropriate medical evaluation and counseling. So nandito po yan, nakapaloob sa DOLE Advisory number 5 para malaman ng ating mga pasyente na hindi sila dapat panghinaan ng loob kung sila ay mag-a-apply sa trabaho. So again, we emphasize we should all be aware, be tested, be vaccinated in case na walang hepatitis B. At kung sa mga pasyenteng may hepatitis B, wag matakot to be treated. Marami pong salamat.
Okay. Thank you, Dr. Conde, Jen, for that lecture. Very informative on the lay person grounds, naintindihan natin yung hepatitis. May we call in now our speakers for this afternoon's webinar, Dr. Payawal and Dr. Jen, for the Q&A portion of our webinar. So I will start with the question, ang isang question ng isang anonymous attendee is this: what are the indications for adults to get hepatitis B vaccination? Ano daw? Siguro na-mention kanina, baka kailangan reiterate. If they have been vaccinated when they were infants, but are HBsAg reactive right now, when can we give the vaccine? Or there is no need? Thank you. So, dalawa yung question niya. So, sa mga may tayong adult daw, indicated kailan daw dapat magpabakuna. Kumbaga, lahat ba daw dapat magpabakuna? And second, yung mga bata na nabakunahan nung bata pa sila bilang nag-positive ngayon, ano daw yung gagawin? Papabakunahan ba or no need?
Ako na lang po, Doktora. So, good afternoon po. Marami pong salamat sa inyong tanong. So, we advise, ideally, lahat tayo should be vaccinated with hepatitis B. So, if there is an access for testing, such as yung HBS AG, anti-HBS and anti-HB core. So, kung makita nyo po doon sa test na yon, kung HBS antigen or HB-SAG non-reactive at ang anti-HBS din po ninyo ay non-reactive, yun po, nangangailangan kayo ng bakuna against hepatitis B. So, for the next question, yung sinasabi na nabakunahan ng bata, however, ngayon, biglang HBs-AG reactive, hindi na ho kailangan ng bakuna dahil infected na ho siya ng hepatitis B at wala na hong bisa ang bakuna ho sa kanya. So we advise lahat ng pasyente ng may hepatitis B, or we emphasize na kailangan ho talaga nagpapa-check up every 6 months or nagpapakonsulta sa doktor kasi hindi natin alam kailan magkakaroon ng or nagde-develop na ba siya ng pagkasira ng atay or liver cirrhosis or nagde-develop na pala siya ng liver cancer para namo-monitor po sila.
Okay, Jen. So, ang sinasabi lang dito, emphasize, bago magpabakuna, kailangan muna mag-test, di ba, Jen? Kasi nga,
yes po, ma'am.
Mamaya hindi na pala hindi nyo kailangan ng bakuna. So, kailangan mag-test muna. Hindi siya tulad ng COVID or ng ibang sakit ng pneumococcal na pwedeng diretso bakuna, di ba, Jen? So, ito kailangan magpa-test muna. So, another question from Mr. Ramon Francisco to our speakers. For patients with anti-HBC or core positivity but HBsAg negative, status post-Hep B infection, na nagkaroon na bali ng infection, do we advise partners and family members to be vaccinated if they are still negative?
Yes po, ma'am. As I've mentioned, so as part of counseling for all patients na nagkaroon ng hepatitis B or merong hepatitis B, na maganda na ipatest din po ang mga kasama sa bahay, pamilya, na to test kung may anti-HBs sila. So in case na wala silang anti-HBs, we highly advise na magpabakuna para protektado po sila.
Okay. So, isa pang question. How do you approach this topic without causing stigma because of the possible cause of anti-HB core positivity? Siguro parang anong ibig sabihin ni Sir dito? How do you approach this topic without causing stigma because of the possible causes of siguro yung naiiwasan nga yung sinasabi mong discrimination, Jen. Paano natin
So that's why we have, marami pong salamat katulad sa tulong po din ng PCP at ng ating gobyerno. So that's why we have this information dissemination and with Hepatology Society of the Philippines, Philippine Society of Gastroenterology, PCP, we work hand in hand with also with DOH na wag dapat wag dapat pandirihan ang mga pasyente na may hepatitis B. Kumbaga, parehas lang din natin, no? Hindi natin nga alam, minsan may katabi na pala tayo na may hepatitis B. Hindi porke may hepatitis B ay nakakahawa po kagad. So that's why we inform the public na they should not be discriminated.
Oo, patient education, no? Yun talagang ang number 1 na nakakatulong. May magandang comment si Mr. Ramon Francisco dito. Very informative lecture, thanks. We should be more aggressive in screening. So thank you, sir, for the recognition. So si Dr. Payawal, ma'am, may question po tayo dito. Good afternoon, doctor. Will you still recommend hepatitis vaccination for a 90-year-old hemodialysis patient who tested negative for anti-HBs? Is there an alternative mode of administration aside from IM for a patient who cannot tolerate IM administration? Thank you.
For hemodialysis patients, it is recommended that you do screening. Kasi iba ang makina na ginagamit sa hepatitis B sa common patients without hepatitis B on hemodialysis. So definitely, kailangan niya po. Ngayon, kung anong sinabi niya, anti-HBs negative, tama ba?
So, bakuna para doktora 90 years old na daw, ipapababakuna pa ba daw? Yun ang tanong.
Kasi kung ang pasyente mo hinihemodialysis, dapat nakabakuna po yan. Kasi pwede ho siyang mahawa. Ngayon, suggestion ko po sa kanya is the vaccination is recommended. Kung ayaw niya ng IV, there is IM. Kasi subcutaneous siguro pwede, pero wala akong data on using an IV. I mean, I don't really suggest it because it's out of the box strategy. So, suggestion ko po sa kanya, sir, and I don't know who the nephrologist is, but the recommendation is if you're anti-HBs negative on a hemodialysis patient, you have to get vaccinated.
Okay, thank you, ma'am. May isa pa tayo interesting, ma'am, na question, no? Good afternoon po. Would like to ask regarding, common question to ma'am. Would like to ask regarding the proper prophylaxis after needle stick injury to a hepatitis B positive patient. Yan, doktora, marami tayong na-encounter dyan. Di ba yung mga nurses natin, nalaman bigla Hep B pa lang tapos natusok po sila or na needle prick. Ano daw po ang gagawin nila sa ganong pagkakataon? From Nelson Joseph Quincena.
Alam niyo pa, ang recommendation po namin dyan for these patients is you have to inform your yung safety officer on board, no? Kailangan po yung safety officer on board nyo, alam po na kayo po ay na-inject na prick, no? And then you will be now prone to close monitoring. Now, hepatitis B is very infectious, and because it has a high concentration in the blood, and therefore sometimes the resistance of the virus to external condition, even if there is a small inoculum, is high index for transmission. So kaya number one, for us, no, we need to ang recommendation ho namin para sa mga healthcare workers is to get vaccinated. Okay, now I go one more step as a hepatologist. I do my anti-HBs titer. So yung anti-HBs, hello, can you hear? Yung anti-HBs titer po, dapat at least 10. So since I am an interventional hepatologist, I do one more vaccination, but that's out of the box strategy. Kasi pag mababa po yung titer, sabi nila, pag hindi ka naman healthcare worker, na-expose ka, you have memory cells and it can actually be increased when you are exposed. So the recommendation of WHO is not to get a booster. But of course, it's different depending on your workload. If you are doing an exposure-prone procedure, meaning you do endoscopy or a surgeon, I think you have to go one more step in protecting yourself if your titer is low, and especially if you're doing surgery for patients with hepatitis B. Okay. Ngayon, para sa naging positive, so ang una hong gagawin natin, patest ho natin kung positive siya, and you actually give an immunoglobulin plus the markers, the 3 vaccinations if you did not do your vaccine. So, pero dapat po, healthcare worker recommendation is different from the typical from the other. So we need to monitor our anti-HBs titer, and we need to get screened for, you need to get vaccination full dose vaccination. In fact, for students who are medical
pa-test. For example, doktora, na needle prick ngayon or mga ganyong pong incidents, di ba? So how soon will these nurses, kasi lalo na doktora, there are healthcare workers na bago lang po, na hindi pa talaga complete pwede yung vaccination of they haven't formed their antibody or parang ongoing pa po yung kanilang vaccination. So,
Opo.
yung testing
Well,
natin.
we do our testing immediately. So you can do your testing immediately. Wala naman pong sometimes it can be delayed, no, but the recommendation is to test yourself for HBsAg because if your hepatitis, if the one who yung nag-prick sa'yo, punta naman yan sa hospital kung matataas yung if they have a liver disease. So you know that this is quite an active hepatitis B, no? And usually, as I mentioned, the hepatitis B virus lives outside the human body for 7 days. So what we recommend is you do your monitoring sa pasyente mo. Ngayon, kung nakita mo naman na HBsAg negative, anti-HBC negative, so you can actually do your routines testing. Pero ako kasi ma'am, pagka healthcare worker ang positive, I already give immunoglobulin.
Okay, ma'am. Thank you. So, another question from an anonymous attendee. Maganda rin po ang kanyang tanong. For a patient with chronic hepatitis B, for clearance in a resource-limited setting, siguro sa rural areas, no, na hindi or walang masyadong laboratories, is it necessary to request for HBV DNA levels prior to giving clearance? Thank you. So, hindi lang pala to sa rural kasi minsan napaka-costly, no? Mahal din po ang HBV DNA levels. So, sa ating dalawang experts, kailangan pa raw po ba ito ipagawa kung chronic hepatitis B na for clearance?
Good afternoon po. So, with regards to that question, so as we know, Philippines is a very resource limited setting, no? So actually, HSP has a guidelines with regards to pre-employment screening or pre-employment clearance for patients with hepatitis B. So as simple as HBs antigen, anti-HBs, at least malaman din yung e-antigen, HBeAg and anti-HBe status ng pasyente. At simpleng SGPT lang po or ALT and ultrasound, pwede na ho natin mabigyan ng clearance yung pasyente. Hindi ho necessarily kailangan yung HBV DNA. Malaman lang ho natin kung saang phase or status yung pasyente na may hepatitis B at saka kung malaman kung ba ng reactivation or kung meron na bang liver cancer sa ultrasound yung pasyente. Siyempre, ibang usapan yon bago natin bigyan ng clearance yung pasyente kung may bukol ng nakikita sa ultrasound. So, simpleng ultrasound po, liver ultrasound, SGPT, tapos yung HBsAg, anti-HBs, anti-HB core, IgG or total, e-antigen and anti-HBe lang po, maaari na po natin itong mga test na to magbibigay ng guide sa atin para magbigyan ng clearance ang pasyenteng may Hep B po.
Okay. Jen?
Hello. Hi, Ginger. Sa mga pasyenteng may hepatitis B na kailangan ng clearance, you need to identify what kind of occupation your patient has. Ito yung tinatawag namin na exposure-prone procedures, EPA. So, kung ang pasyente ay nagtatrabaho sa exposure-prone procedure, in fact, if you are like an intern just doing, hindi naman ikaw nag-oopera, you don't need to get a DNA. So, yung sinasabi ni doktora na i-clearance mo ng DNA, I think that's an overkill. In fact, the recommendation of WHO now is to shy away from the DNA because nga, it's a very expensive test, and it is actually limitation for an exposure prone for a resource limited country like us. So marami hong guidelines you can do. Let's say if you are a carrier, if you have already a fibroscan which is like less than 4,000, ikumpara mo yung DNA nasa 5 to 6, no? So I think that would be a better strategy of assessing fibrosis. Now, kung wala namang fibroscan sa area ninyo, you can do the fibrosis scoring. So there are a lot of, there's the APRI test that is recommended by WHO. So these are new strategies for resource limited countries.
Thank you, ma'am. Ma'am, may dalawa pang question na related, no? Ibato ko na lang to sa iyo, ma'am. Na-mention mo na po kasi yung fibroscan. What do you monitor every 6 months in a case with chronic Hep B? Is a fibroscan that important? Yun, ma'am. Na-mention nyo po na kasi yung fibroscan. Saan po ba ginagamit yung fibroscan at saka kailangan ba daw every 6 months?
Yes. For one, I think you have to individualize the use of fibroscan. The WHO that is recommended, if you don't have the fibroscan, you do the APRI test, no? So this is just the use of the platelet count, and it's an app that you can have in your phone, no? So hindi ho namin nire-recommenda outright. Now, the difference with the fibroscan and the others is you have a number. Pag may number kasi, makikita mo yung regression, no? So kunyari, naggagamot ka, yung sinabi ni Dr. Agkawili, naggagamot ka sa pasyente. Tapos, gusto mo malaman kung yung fibrosis niya nag-improve. So parang cholesterol, di ba? Ang cholesterol, kung nag-improve yung cholesterol ng pasyente, makikita mo, bumababa yung cholesterol level. So ganyan din, there is a point of regression of your fibrosis score. Kasi napag-aralan na that the fibrosis is an indicator of progression of liver disease. So kunyari, moderate SGPT mo normal, pero mataas yung DNA mo. Dati, humihinto na kami doon. Pero ngayon, ang rekomendasyon, pag gumawa ka ng APRI score or fibrosis score and it is moderate, then you need to treat your patients.
Okay, so individualized, ma'am. Guidelines.
Opo.
Isa pa pong related question. Students studying HRM, food handlers, are asked to be Hep B vaccinated. Is this required or just recommended? So, our existing law state that hepatitis B carriers should not be denied to work. Siguro magkaibang question, isang pinagsama lang niya. So, ang tanong, ma'am, yun nga daw yung mga food handlers, dapat ba daw talagang
Matagal na naman sabihan yan na you should not use it. You should not use it as a for patients. In fact, there's a big restaurant who I elevated to the DOLE on them recommending their patients or their food handlers with hepatitis B not being given the chance to be employed. No, so meron na ho kami. I think I mentioned it in my lecture that there is already a move. I think that was like 6 or 7 years ago pa yon, na nilakad ho namin yan when I was the president, that it be closed as early as that, and it was convened 2 years after. So alam niyo naman kung gaano katagal already an administrative order from the DOH.
Okay, so dapat
it is recommended, but it is not required.
Okay. Very clear. So ito pa po, guidance
Ma'am.
sa inyo. Yung mga booster daw po.
Oo. So, kung kayo po ay may ganyang problema, I think the Hepatology Society, I think Dr. Agtowili is actively in the Hepatology Society right now. So she can actually help you. They have established a lot of hotlines. There is a Yellow Warrior Society of an advocacy for patients with hepatitis B. Get in touch with their president. They have already a movement for those people who are discriminated from work that is not exposure-prone procedure.
Okay. So ma'am, pwede silang mag-contact sa Hepatology Society of the Philippines kung may mga ganito silang problemang nararanasan, no? Para sila po ay matulungan. So thank you po sa ganyang movement. So ma'am, dako naman po tayo dun sa hepatitis B booster. May dalawang tanong na ipagsasama-sama na lang natin. Gaano ba daw kadalas ibigay ang booster? Ano ba ho daw ang guidelines sa hepatitis B booster?
Wala hong wala hong rekomendasyon sa booster. Ang tinatawag naming booster is the third dose, 016. No, the 60, that's the baseline month. 1 is the month, 1 month after the baseline, and then 6 is the 6 month. Yun lang ho ang rekomendasyon. So, because the issue here is that you develop memory cells, and these memory cells get activated once your hepatitis B titer goes down. So kung kayo po ay hindi healthcare worker, I think when you have the 016, that's good enough. So hindi na ho kami nagre-recommenda ng booster. Wala hong evidence yun.
Walang evidence, ma'am. Kasi ma'am, di ba may mga healthcare workers, mahilig na, lalo na doktora kami sa dialysis. Di ba parang, as in talagang doktora, nagpapatiter yung mga staff namin kasi they really have
Yes.
good. So pag nakikita doktorang bumabalik yung titer, parang gusto nila agad doktora magpa-booster. Pag nakikita na lang
kasi nga, naintindihan ko yan eh. Kasi, syempre, unang-una, prone sila sa variants of hepatitis B, and the COVID is an example, no? So, I think you should also look into those na may mga pasyente na siguro carrier but they don't really manifest it, no? So these are things that you need to identify, because hemodialysis patients are a different kind of patients, no? So I think you should advocate vaccination. Ako, para sa healthcare worker, it's individualized. As I mentioned, if you are working in an exposure-prone procedure, like Dr. Agtawili and I are both doing endoscopy, and even the surgeons, probably you need to do measuring of your titer. Now, for kayo naman sa hemodialysis patients, I think you should, although there are no guidelines that you should, but I think you should measure the protective effect or the protective level of anti-HPS. Ngayon, para sa mga healthcare workers, if you are actively and you have problems on your unit, siguro I think you can recommend. So wala naman pong nagsasabi na huwag kayo magpa-booster. Pero ang rekomendasyon ho ng WHO is only 3 vaccinations. Kasi ho, napag-aralan na yan eh. So as I mentioned, maybe there is no need for you to get a booster if you are not working in exposure-prone procedures.
Okay, very clear. Merong isang question, ma'am, regarding siguro on the side na po to, yung SGPT levels daw, ano ba yung level na pwede daw i-clear ang isang pasyente?
We have already, that is an often asked question because the pivot of treatment is based on the SGPT. Ngayon, every laboratory has a different level of SGPT. Like kami sa Cardinal, we have 70 to 80, which is quite high, no? But in St. Luke's and other centers, it's 34, no? So, ang rekomendasyon po ng US is about 30 and 40, no? But that's, I think, a little low. So, pag pumasok po yan, pati yung maraming pasyente ko ang papasok sa monitoring yun, and that's not cost-effective. So what we use what is recommended by the Asia Pacific guidelines, and it is used in all of the consensus guidelines, is 40. So 40 po ang ginagamit namin.
Thank you, Doctora. So I think we had marami, I know you have more questions, but syempre limited po ang time natin. So if you have any more questions, you could contact us in our Facebook account, and later on we will get in touch with you. You could email us. So sa ating mga speakers for this afternoon. I know man pala mag-ano tayo, no, yung hepatitis. This is the World Hepatitis Day, no, on July 28. Kaya nga po tayo merong gantong lecture. So, any words po sa ating mga followers, sa ating mga attendees regarding yung objective po ng ating lecture for this afternoon? Any words from you?
Maybe Jenny can start. I'll speak for PCP. Jenny, sige.
Opo. So, marami pong salamat. So, in celebration of the World Hepatitis Day on July 28, so Hepatology Society of the Philippines have several activities po. So, we also invite everyone on July 30, Saturday po, there will also a webinar together with Professor Payawal and as well our past president, Dr. Edel Tripon. Also, on Sunday, we have a booth po activity sa Lucky Chinatown po. So everyone are invited to pass by sa Lucky Chinatown. There will be some doctors who can entertain you and will also give leaflets po for information with regards sa viral hepatitis po. Thank you po.
Dr. Payawal.
Hi. First of all, I'd like to thank, of course, Ginger from the Committee on Media for putting this together. I know it was, as you noticed, we first started with monkeypox, no? And look at it, it's now a health emergency. Kaya timely yung aming initial media hype on monkeypox. And since this was already part of our strategy for the World Hepatitis Day, then we pursued even if it's in the afternoon. Now, World Hepatitis Day is a WHO-generated activity of celebrating July 28. So it's actually given that the week of July 28. So all hospitals have their own webinars to center on the community. I saw may pakpak in Marawi of under Dr. Abdel Lukman. I saw webinars of World Hepatitis Day from St. Luke's under Ian Kua and Dr. John Pangilinan. We have one in Fatima under Dr. Robert Lopez and Marlene Te and Nico Ong. So there are a lot of areas that are actually putting webinars for information dissemination. Sana po ay makinig po tayo because hepatitis B is something that has a dreadful course, no? Matagal nga lang siya, sinasabi nagkaka-cirrhosis, liver cancer, but you can see that the hepatitis B has dropped, and that is because of vaccination coming out now. No, you can see na yung liver cancer dati secondary to Hep B, ngayon fatty liver na. So I think this is one way that we were addressing all of this concern. Naging problematic kami, pero ngayon may mga gamot na, just like COVID, may mga gamot na, may vaccine na. So I think we should all work together in the viral eradication program of the WHO by 2030. So I thank the media for staying on. I know there was a diabetes this morning, and I do look forward for you to partner again with us. We will have now, and this is going to be spearheaded by Dr. Ginger Samonte, on a Radio Veritas program. And I'm very happy that they got in touch with me this afternoon that we will start our works with the Committee on Media of the Philippine College of Physicians for this information dissemination program of different aspects. No? So again, from the Philippine College of Physicians, we'd like to thank you for joining us.
Thank you, ma'am. Dr. Payawal, President of the Philippine College of Physicians, and also a specialist in the liver, ma'am. Thank you. And Dr. Jen Agkawili Conde, thank you for sharing your expertise and also promoting World Hepatitis Day here in the Philippines. So before we end this webinar series in the afternoon, we would like to call on the Public Relations Officer of the Hepatology Society of the Philippines, Dr. Vanessa Co Tangco, to give her closing remarks. Dr. Tangco.
So good afternoon to everyone. We've learned a lot about hepatitis B from our speakers today. So we know that it's a serious problem in the Philippines. It remains to be the leading cause of chronic liver disease, cirrhosis, and liver cancer, and that 10 million Filipinos are afflicted by this disease. And though there has been recent strides in development of effective antivirals, there still is a wide gap existing between the actual cases and the number of patients being diagnosed and treated. As such, there is an urgent need for hepatitis B screening, treatment, and especially prevention. On behalf of the Hepatology Society of the Philippines, I'd like to express our sincerest gratitude to Dr. Diana Payawal, the Philippine College of Physicians, Dr. Janlyn Agkawili Conde, all the viewers and our media partners who are joining us today this afternoon. Everyone has an important role to play, and it's only through our partnership and working together will we succeed in achieving a hepatitis-free Philippines. And the time is now, and uh, because HEP can't wait. So this is the tagline that we're using for World Hepatitis Day 2022. And this is our petition for hepatitis B elimination. So thank you very much to everyone.
Thank you. So again, thank you very much for attending this afternoon's webinar. Tandaan po regarding sa hepatitis, no, marami yung klaseng hepatitis, pero kinoncentrate po natin yung hepatitis B and C. Have yourself tested. Pag once na-test kayo at rekomendado ang pagbabakuna, have yourself vaccinated. Para maingatan po. No? Marami na tayong health problems na kinakaharap sa ating bansa at ang hepatitis ang isa sa mga problemang ating hinaharap na nagkakaroon na po ng pagkamatay, di ba? Marami na mamatay or lumalala ang sakit dahil dito. So, wag nating kalimutan na magpabakuna kung kailangan nirekomenda ng ating mga doktor at magpa-test at magpabakuna. So bago tayo magtapos, kung may mga tanong po kayo, if you have any questions, clarifications, comments, and suggestions, please feel free to contact us in our email and our Facebook account and our other social media accounts. So may mga announcement pa po tayo from the Philippine College of Physicians. Ini-invite po namin kayo sa ating mid-year convention sa Subic on November 2022. Ito po ang ating poster. And then yun nga po yung invitation ng ating mga kaibigan sa Hepatology Society of the Philippines. Another webinar on July 30 and the celebration of World Hepatitis Day. So kung may mga tanong po kayo at gusto kayong i-share sa amin, feel free to contact us. So hanggang sa muli, ito po ang ito po si Dr. Ginger Samonte, ang inyong head ng Media Communications ng Philippine College of Physicians. Maraming salamat at hanggang sa muli. Thank you.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.